Up next is our health and wellness segment brought to you by True Serenity Tea, an award-winning affordable monthly subscription box that contains premium loose leaf teas from around the world with tea blends and tea accessories that are shipped directly to your door every month. Visit www.trueserenitytea.com and use the code #StayHome at checkout when you buy one of the recommended COVID pandemic teas, the Relaxer, Be Well Tea, and Blissful Turmeric. Today we have telemedicine and immunology expert, Dr. Tania Elliott. How are you?
I'm doing well. Thanks for having me.
So how are you staying healthy while we're all stuck indoors? How are you doing?
Yeah, I'm hanging in there. I actually have a daughter who just turned 1, and I have another baby on the way. So it's been challenging for me, both a medical professional and making sure that I'm available to my patients through telemedicine, and then also being a patient myself and trying to navigate this healthcare system, especially as a pregnant woman, sort of not knowing what to expect and how this disease impacts a pregnant person. So I'm wearing two hats, and we're just doing our best to juggle everything.
So let's talk about telemedicine. Can you explain to our viewers what exactly it is, how they can go about doing a telemedicine, having a telemedicine situation set up with their doctors? How do we go about this?
Sure. So the good news is that the state and federal governments have loosened all regulations as it relates to getting doctors to interact with their patients through telemedicine. So just to define what telemedicine is, it is real-time audio-visual communication between a doctor and a patient when they're not physically in the same place. So the best way to think about it is having a FaceTime or a Skype with your doctor. And so previously it used to be that you have to use a specific HIPAA compliance software and certain technology platforms, and a lot of doctors' offices weren't set up for that. And then also on the insurance side, there wasn't proper reimbursement for doctors to be able to conduct visits this way. So now all that's gone away. You can FaceTime with your doctor, you can Skype with your doctor. And I've been doing telemedicine for about 7 or 8 years now and seen thousands of patients. And I can tell you that you can still provide high quality care through a video consultation between doctor and patient.
Awesome. So when it comes to being at home and stuck at home while we're doing all of this, what are some tips that people can use to stay healthy at home? And even for a pregnant woman, like you mentioned, for everybody, but we can focus on, just general health, and then we can definitely touch on pregnant women. I feel like I've seen so many women concerned now about being pregnant at home while, stuck during all this with the coronavirus.
Yeah, I could just start with pregnancy is just making sure that you're still keeping the essential appointments. So I just had my fetal anatomy ultrasound. So things like that are truly important. That's the one you're supposed to get at the 20-week mark. But there are other ones that are non-essential visits that where you don't need to physically go into the doctor's office for it. And that's a great use case for telemedicine. So I have a blood pressure cuff at home so I can check my blood pressure. So for pregnant women, high blood pressure or diabetes, those are 2 things that are important to screen for, as well as checking your weight regularly. So I have a blood pressure cuff at home, and I would recommend for all patients to do that. Also getting a glucometer to check your finger sticks, your blood sugars, to screen yourself for diabetes, because previously that was a test that was done in the office. And then also just checking your weight regularly and making sure that you're gaining weight at the appropriate schedule, and certainly not losing any weight. Outside of those sort of screenings for the pregnant person that I've been going through myself and having to sort of ad lib a little bit on making sure I have those devices at home to get that objective information over to my doctor, it's really important to make sure that you keep routines. That's, if you have children in the home, making sure that they're doing their e-learning, and then also for yourself. So get dressed in the morning, put on your makeup, don't stay in your pajamas all day. Have set routines in terms of your meals and your snacks, and make sure that you have a separate work area that's separate from where you're eating your meals, that's separate from where you're sleeping. Please don't do work in your bedroom. And then starting and stopping your day at the same time. I also encourage people to go out and take a walk and have that sort of emulate what your morning commute looks like. So instead of getting in your car and driving, you go outside, you take a 15-minute walk, and then you can come back inside and start your day. So try to simulate what it's like to do a morning commute. So things like that, just to make sure that you keep your routine. That's really how you can stay healthy.
Yeah, I definitely think that routines are very important. I know that in the beginning of all this, I would stay in my bed all day, and that was not a good idea. But I've gotten better with my routines on a daily basis. So for those, and I think this is a concern as well for those who have had sicknesses or other chronic diseases before COVID-19 came out. How do we continue to keep those people healthy? What steps should they take? Because they might be concerned that they might be overlooked when it comes to their sickness, or they might not be able to get the medicines that they need. So what advice do you have for them?
Yeah, I was just reading a statistics today that almost 80% of outpatient doctor visits have been canceled or rescheduled. That's really scary because we know we have people who have chronic diseases, and we know that people with chronic diseases are at higher risk for developing coronavirus. So it's really important to still maintain contact with your doctor, and that's where the telemedicine comes into play. Doctors' offices now across the country are offering it. So if you had an appointment, instead of just canceling it or rescheduling it, make the phone call, get connected with your doctor. You could either do a video visit with them or talk to them over the phone. Check in with them on your symptoms. As I mentioned, if you have diabetes or high blood pressure, have the glucometer at home, have a blood pressure cuff at home. It's important to get that objective information and provide that to your doctor. And then make sure that you have a supply of your medication. So connecting with your pharmacist, making sure that you have enough refills, asking your doctor for refills. I recommend that patients have at least a 2-month supply of their chronic medications during this period of time, because we don't know when you'll be able to get back in to see the doctor in person.
Right. Well, thank you so much, Dr. Elliott, for your insight. I hope our viewers were able to take something away from that. Get up, do your routines. If you have to get your medicine, that's very important as well. So thank you so much for joining us.
Yeah, thanks for having me. The one other thing I'll say is I want to give some shout outs to local pharmacies that are offering delivery services, places like GNC also that are doing curbside pickup so people can get vitamins, supplements, doing the best to sort of fill in those gaps. And, so kudos to all of those businesses out there that have quickly transferred over to offering delivery services to bring the appropriate medications and other things people need for their health into their home.
Yes, absolutely. Thank you. Thank you to all of, honestly, all of our essential workers, but they
Everybody.
really make a big difference for people who have some medical issues or need their medicines. So thank you so much, Dr. Elliott.
All right. Thanks for having me.